In the beginning of 2020, the world was introduced to a new virus that would forever alter the course of history. This virus, known as SARS-CoV-2, is responsible for the disease COVID-19. It is believed to have originated in bats, with the first known cases linked to a seafood market in Wuhan, China. The exact pathway of transmission remains a subject of investigation, but it quickly became apparent that this virus was unlike anything the world had seen in recent history. As the first cases emerged, the virus spread rapidly. By the end of January 2020, COVID-19 had reached several countries outside of China, including Thailand, Japan, and the United States. The World Health Organization declared a public health emergency, but the virus was already on the move. Within weeks, infections multiplied exponentially, with countries scrambling to contain the outbreak. The virus was transmitted primarily through respiratory droplets, making it highly contagious. The world watched in horror as the number of cases climbed, and soon it was clear that this was not just a regional outbreak, but a global pandemic. By March 2020, COVID-19 had spread to every continent, and the World Health Organization officially declared it a pandemic. Governments around the globe instituted lockdowns, travel restrictions, and social distancing measures in an effort to slow the virus's spread. The impact was immediate and profound. Schools closed, businesses shuttered, and millions of people were forced to adapt to a new way of life, often working from home or losing their jobs entirely. The global economy began to falter, with industries such as travel, hospitality, and retail facing unprecedented challenges. As the pandemic progressed, the statistics became staggering. By the end of 2020, there were over 80 million confirmed cases worldwide, with more than 1.7 million deaths attributed to the virus. The numbers continued to rise in 2021, and the world was forced to confront the harsh reality of COVID-19. Healthcare systems were overwhelmed, and frontline workers faced unimaginable pressures. Families were torn apart, and the emotional toll of isolation, grief, and uncertainty weighed heavily on society. The pandemic also highlighted existing disparities in healthcare access and outcomes, with marginalized communities disproportionately affected. The virus did not discriminate, but its impacts were felt unequally. The mental health crisis that emerged alongside the pandemic became a critical issue, as people struggled with anxiety, depression, and the loss of loved ones. However, amid the darkness, there was a glimmer of hope. Scientists and researchers around the world worked tirelessly to develop vaccines in record time. The collaborative efforts between pharmaceutical companies, governments, and health organizations led to the creation of several effective vaccines, including those developed by Pfizer-BioNTech, Moderna, and Johnson & Johnson. By the end of 2020, the first vaccines were being administered, marking a turning point in the fight against COVID-19. As vaccination campaigns rolled out globally, the world began to see a shift. By mid-2021, millions of people were receiving their vaccinations, leading to a decline in severe cases and hospitalizations. Countries began to reopen, and there was a collective sigh of relief as people reunited with family and friends. However, the emergence of new variants, such as Delta and Omicron, reminded everyone that the fight was not over. These variants posed challenges to public health efforts, but they also highlighted the resilience and adaptability of humanity. Throughout the pandemic, individuals and communities demonstrated remarkable solidarity. People came together to support one another, whether through volunteering, donating to food banks, or simply checking in on neighbors. The pandemic fostered a sense of global interconnectedness, reminding us that we are all in this together. As we reflect on the impact of COVID-19, it is essential to recognize that the road to recovery is ongoing. The pandemic has reshaped our world, but it has also ignited a renewed commitment to public health, science, and community resilience. Governments and organizations are investing in healthcare infrastructure, ensuring that we are better prepared for future health crises. Education systems are evolving, with a focus on mental health and well-being as integral components of student support. The workplace is changing, with many companies embracing remote work and flexible arrangements as a permanent option. As we move forward, it is crucial to remain vigilant and continue to prioritize public health measures. Vaccination, mask wearing, and hygiene practices will remain essential tools in our fight against COVID-19 and any future pandemics. In conclusion, the journey through COVID-19 has been one of immense challenges and profound lessons. The statistics may paint a grim picture of loss and suffering, but they also tell a story of resilience, innovation, and hope. As we emerge from this global crisis, we carry with us the knowledge that together, we can overcome even the most daunting challenges. Let us honor those we lost by committing to a healthier, more equitable world. The road ahead may still have obstacles, but with unity and determination, we can build a brighter future. If you found this video informative, please like, share, and subscribe to our channel. Join us as we continue to explore the stories of resilience and recovery, and stay informed about the ongoing journey of humanity moving forward together. Thank you for watching.